Right. Hello, my name is Vicky. I'm from the Wirral and part of the National Co-Production Advisory Group. And so, can you start by telling me what your name and your role is, please?
So my name is Dawn Wakeling. I'm the Director of Adult Social Services here in Barnet, which is a London borough, but also for ADAS, that's the Association of Directors of Social Services in Adults. I'm their Personalisation Policy Joint Lead.
Personalisation Policy?
I know, it's a mouthful, isn't it?
Oh my gosh. So you're the person they come to if they need advice on personalisation, eh?
Exactly. So over the years, the ADAS has done a lot of work with the Co-Production Advisory Group, the Department of Health and TLAP, Think Local, Act Personal, to develop and embed self-directed support and personalisation. So the role of a policy lead is to give opinions and advice and help.
Oh, fantastic. And so, that moves us on nicely to question 2. What have you done in terms of co-production?
Well, for me, I think co-production's been around as part of my career from the very start. So I started off as a social worker in mental health, and me and one of the people I supported, a person with mental health problems, we came up with a great scheme to get everybody in the town on mobility component of disability living allowance. And it was really his idea, but I helped him make it happen, and it worked. So we worked together on kind of welfare rights for service users. But since then, I then went to work for National Mind, and I supported MindLink, which was the national user network. I was a trustee of Mental Health Media, which was a service user-led charity focusing on stigma reduction. So for me, it's always been important. And if you look at some of the big breakthroughs and developments in health and social care over the course of my career, people with lived experience of disability have been instrumental in making those improvements. So it was disabled people who developed self-directed support and the idea of a direct payment, and the whole notion of recovery in mental health was fundamentally developed by people with mental health problems themselves.
So it's working with them in the co-production and the experts by experience.
Exactly. And I think if you haven't had lived experience of disability or a long-term health condition or some kind of mental health difficulty, but you put yourself in the position of being a user of a service or a customer, then you would expect to have your views listened to. You would expect to be able to say, this is how I want things and this is what will help me. In the same way as if you go into a restaurant, you don't expect somebody to tell you what you order, you make your own choice.
What have you done in Barnet in terms of co-production?
Well, if I could talk about 2 things we're doing at the moment, which I think are really exciting. So the first is a mental health example, but we've been working with service users and carers to rethink how we provide social care support to people with mental health difficulties. We have a co-lead for the project, so I have a professional staff member lead and I have a service user lead for the project, and between them they're leading a whole programme of work that is completely redesigning our mental health social work service to focus on enablement in mental health, on recovery, and particularly on the things that really matter to people, so a much greater focus on employment and housing and community and social inclusion. Another thing that we're doing at the moment in Barnet is looking at how we support young adults with disabilities. So we're creating a service that will support and work with people and their families from birth to the age of 25. And we have a design working group that includes service users, but also parents and family carers working together alongside practitioners from both children's services and adult services to think about, well, what is the pathway that we want to put in place for people? How will we make this easy, and how will we work with the whole family to support the young person to fulfil their potential.
Absolutely. Okay. And so on that, can you reflect on what you have learned from that?
So I think everybody wants to do co-production, but it isn't always easy. And there are lots of things that can get in the way. So people maybe start with the best of intentions, but perhaps it doesn't always go according to plan. I think it's really important to support people who have lived experience of disability by giving them a very, I suppose, comprehensive and thorough, personalised support to help them play their full part. I think it's really important that professionals learn how to work with service users, people with lived experience. You know, some of the basic stuff that people still forget, which is don't speak in lots of professional jargon. A long time ago, I used to run the process for approving. They were then called approved social workers, now they're called approved mental health professionals. And I worked with some mental health service users to make sure that they were part of that approval process. They were members of the approval panel, and this was a long time ago, it was back in the 1990s. And what I learned from that experience was that it was the professionals who needed as much, if not more, training to work in a co-production way than the service users. The service users were perfectly capable, but it was the professionals who weren't good at listening, who spoke in ways that were very inaccessible, and who weren't necessarily, this was a long time ago, weren't necessarily, I suppose, fully geared up to kind of be open and change the way that they worked to make sure that everybody was included.
And what difference has it made in working in that way? Those are the people you work with in the organisation you work for.
So when I worked, before I came to Barnet, I worked in Islington, and I was responsible for implementing self-directed support and personal budgets, direct payments, personalisation. And in terms of the programme that we set up, we made sure that the ultimate decision-making body, the programme board, was 50-50 service users and professionals. And that helped us make self-directed support much better in Islington. It made sure that we were able to communicate with a very broad range of people with lived experience of disability, a very broad range of people who used all kinds of different services. And we were able to shape the process and how staff worked, so that people were able to get the maximum benefits from, you know, this big policy change in social care.
Okay. So now you keep mentioning people who use services, and now I assume that includes all manner of different services, like say day centres as well. How day centres and other community services and that as well, does it?
Absolutely. So I think language can be really important in terms of co-production and inclusion. So probably you've noticed that I've used lots of different words to describe people, disabled people, people with lived experience of disability. And I think it's really important to use language that people themselves feel comfortable with. And I know that in the service user movement, there's lots of different ways that people like to be described.
Can you give me an example on how it is avoided making costly mistakes by getting it right or better first time through the co-production?
A few years ago, I was working in the NHS in a hospital, and we wanted to improve the way our accident and emergency department worked. It was extremely busy, it wasn't doing very well on its 4-hour target, and more and more people were coming to it, even though right next door to it was a walk-in centre. So people were still going to the A&E even though the walk-in centre was just a few feet away. So we advertised in the local paper and recruited some local residents, people who'd been patients at the hospital, who had GPs in the area, and they worked with us on a project to change how people could access urgent care. And we ended up developing a model where we got people from staff from A&E and staff from the walk-in centre to work together on a different kind of patient journey, the NHS would call it. But that was very much designed with the insight of the people who had been to the A&E, had been to the walk-in centre, could tell us, you know, why they went to A&E as opposed to the walk-in centre, so we could address the issues.
So it's kind of like a what's the word? And prevention is better than a cure.
Absolutely.
Educating people, which could potentially save money on the A&E. So, based on your experience, do you have any top tips for co-production?
Top tips. So I think it's better when you have a bit of money to support it. So I'd put some money into it. I think it's really helpful to have very clear roles and responsibilities for everybody involved. I think we need to, as a professional, it's really important not to put a disabled person into a really difficult position where you're asking them, for example, to represent the views of everybody in the town or anything like that. And I think it's really important that the professionals are really clear about how they need to work to make it right. And I suppose my last top tip is about honesty. And sometimes I think as professionals, you know, it's hard to say, oh, actually, we can't do that, or it's not worth, we really can't do that. It's not worth making that suggestion because we haven't got the money for it. But I think it's much better to be really clear on what the limits are, because the people you work with, in my experience, are very sensible, very intelligent. They understand the realities of the world we live in the public sector.
Absolutely. Very good tips there, Dawn. Is there anything else you would like to say about co-production?
I was thinking before we had this conversation about the impact of funding changes in the public sector. So if you think that the last period of financial austerity in public services started in 2010, 2011, and now in 2015 we are entering another period of 5 years of austerity that will mean, particularly in my world, in social care, very real funding reductions at a time when, you know, people's need for social care is not diminishing. So that means for people like me and the community that I serve, we need to get, you know, the absolute best outcomes from, you know, the money that we do have. And in my view, co-production is absolutely vital to doing that. So if we don't have as much money, we have to make sure that the money we've got is focused on delivering the outcomes that people want. So I suppose my final thought is, you know, we don't want things like co-production or service user engagement to be seen as a luxury. I think it's absolutely essential to address the challenge that we will all go through together over the next 5 years.
Absolutely. Well said. And last but not least, and what advice would you give to other directors on co-production?
Oh, I'd hesitate to give advice to my other directors because I think they all know a lot more than me.
Well, what about a director you don't know, say a director in Newcastle, for example?
I think it's really. I think the points I made a bit earlier about being really clear, making sure professionals are prepared, being honest with service users. But I think isn't the important thing that we keep doing this, and we're all still learning, and you know, and it will continue to learn. We'll never get to a place where we think, okay, we've done it all. There is nothing more to be gained from co-production. So I think you know, the next 5 years are potentially really exciting in terms of coming up with things that are really innovative and creative by working together.
Absolutely. And working together, learning from each other. And okay, hey, well, thank you very much for your time, Dawn.
You're
It was lovely
welcome.
to talk to you, and good luck.
Thank you.